Despite significant advances in treatment of ovarian cancer, nearly only about 45% of women survive 5 years, and this is because majority of the women are diagnosed with late-stage disease. In the UK collaborative trial of ovarian cancer screening, we have worked to determine whether screening by picking up the disease earlier could impact on mortality. And we have completed a huge randomized control trial. Tomorrow I'm going to present some of the key results of that trial.
Okay. And can you tell us what results we can look forward to?
Sure. So in this trial we were comparing two forms of screening. A multimodal screening, which is based on a blood test for CA125, which we interpret using ROCA, and ultrasound screening, where the women come in every year and have an annual ultrasound scan. So in this very large, in fact the largest randomized control trial with 202,000 women, tomorrow's results will show what is the difference, how the two screening strategies performed, and whether there is a stage shift in the screen arms compared to the control arm.
Okay. And from the multimodal side of things, what kind of impacts are you seeing there with the regular checkups?
So in both arms, really, the women had screening every year for about a median of 8 years, a range of 7 to 11 years. We followed them up for a median of 11.1 year. And in the multimodal group, what we see is that the screening strategy picked up 86% of the invasive primary epithelial, ovarian, peritoneal and tubal cancers which were diagnosed within 1 year of a screen. And we undertook 4 operations for each ovarian cancer that was detected. And another key finding is that we had a significant stage shift. So while only 26% of women in the control arm were stage 1, 2 or 3A, in the multimodal arm, 40% overall were stage 1, 2 and 3A. So there was a significant stage shift. And that, I think, is the most exciting result from this time's ASCO's presentation.
So by catching the cancer earlier, have you had any patient feedback, for example, any anecdotal evidence for people who are being involved in the trial?
They've come year on year for many years, like 11 years in many of them. So in those who have been detected early, we have had lots of individual letters, but of course the most important thing is that we have followed up everybody through follow-up questionnaires and through linkage to look whether they have lived or died as of December 2014. And this was already published in The Lancet previously, and what we have seen is that this stage shift that we are presenting tomorrow may translate, though we don't have absolute definitive results, into a possible 20% reduction in mortality. But in our mortality analysis, the results are not entirely significant, so we are going to follow up the cohort for another 4 years to confirm that the stage shift does have an impact on mortality.
Okay. Has there been any information coming out of that for people who are advancing from stage to stage, if there's any developments, for example, catching things before they become metastatic up to stage 4?
No, this is very much about picking up the cancer earlier, not about our post-diagnosis, the trial, not about recurrence or treatments or post-diagnosis.
Is there anything that you would like to add?
UKC Talks is the largest ovarian cancer screening trial, and we enrolled just over 202,000 women who were randomized to a control arm, 100,000, who had no screening, and screen arm where the women had 2 forms of screening as I described. It's funded by the big public funding bodies in the UK, the Medical Research Council, Cancer Research UK and the NIHR together with the Eve Appeal, and it's a 13-center randomized control trial.